Hi, I'm Dr. Robert Meyer. Learning you have been diagnosed with prostate cancer is a life-changing moment. If you're dealing with prostate cancer, consider Cyberknife treatment at Swedish Medical Center. We have the most experienced prostate cancer team in the Northwest to help you win the fight against cancer. We use Cyberknife technology to target cancer in the prostate, and treatment can be done in 5 quick sessions.
So the Cyberknife is essentially a high-dose radiation treatment. It's essentially a non-invasive curative treatment of prostate cancer.
The Cyberknife was FDA approved back in 2001, and then a few years later, the first prostate patient was treated at Stanford University, where the device was invented. The device treats from a spherical geometry using a articulated robotic arm. It treats from 100 or 120 different points from a sphere.
This machine, because of its precision, it can track motion with at least 1/12 of an inch accuracy.
It is a 5-day treatment course. It's shockingly quick to go through this week of treatment.
What's unique about the Cyberknife platform is it's the only radiation platform that can track the real-time motion of the prostate or the organ that we're treating. And as the patient's breathing or slightly moving or there's changes in the anatomy, it will lock on and make the real-time shifts with the robotic arm. And that's not something that's not available with the other types of radiation machines.
These machines, these radiosurgery machines, Cyberknife, provides 30% higher radiation dose than all of our conventional radiation treatments. 30% higher. That translates to cures.
The Cyberknife, unlike conventional radiotherapy, is completed in just 5 fractions over 1 week. We've looked really carefully at the outcomes with the Cyberknife, and what have we found? We found that it delivers superior cancer control compared to conventional external beam radiotherapy or IMRT or proton beam therapy. But in addition, just as important, the Cyberknife has fewer long-term side effects.
One of the first steps we do is we place gold markers in the prostate himself through a needle, similar to a biopsy needle. That's really the only invasive part of the procedure.
And the Cyberknife is able to track those gold markers. As the prostate moves, the Cyberknife sees it and it corrects on the fly for any change in motion, and then treats after correcting for the change in position. So it delivers radiation with under 1 millimeter of accuracy. And when you come in, you can just wear loose-fitting clothes, lie on the table, we line you up, and then the computer takes over. It very precisely delivers the radiation, usually in about 30-35 minutes.
It's surprising to patients how the feel of treatment is more like a spa than it is like a hospital. The staff is really nice, it's not painful or difficult or challenging.
And people go to work and then they come back, stop by here on the way home, and then they go back the next day, and people at work don't even know that they're getting cancer treatment.
So with Cyberknife, your treatment is done in 5 days, as where other treatments, your treatments can last, several weeks, up to 8 weeks. And so you're getting side effects for that whole radiation treatment period time and continuing after. Cyberknife, you do the radiation in 5 days. You have side effects that peak for a couple of weeks and then they begin to improve. And so then if you think about that, you're getting 8 weeks of treatment. That's 8 weeks of side effects and continual side effects. And then you finish the radiation and side effects are continuing, whereas we get it all done in a week. So then it's get through the side effects quickly and then you move on.
I've treated many hundreds of patients, and I've followed some of them for 15 years, and almost uniformly the patients are satisfied with their outcome. They have minimal changes in their quality of life. They're able to go through the treatment and continue to do the activities they were doing before. And most importantly, 10, 12, 15 years later, the vast majority are free of cancer.